If you've ever had a kidney stone, you know that pain is something you will literally never forget. But what happens after that initial agony? It can get pretty confusing, right? So what we're gonna do here is cut through all that confusion. We'll break down the treatment options and help you feel like you're in the driver's seat of your own care. Okay, let's dive in.
First things first, let's just be real about what we're dealing with. Just take a second and think about it. What's the most intense, off-the-charts pain you could possibly imagine?
Yeah, and no, you are not exaggerating. A lot of people put it right up there with things like childbirth or breaking a major bone. It is an absolutely profound, incredibly painful medical event.
So let's start where this journey begins for pretty much everyone. The attack. That sudden, just overwhelming wave of pain that seems to come out of nowhere.
The official medical term for this special kind of agony is renal colic. And what's really happening here? The pain isn't just from the stone existing. No, it's from the stone moving and creating a blockage. It's like a dam in your body's plumbing, and that pressure and cramping is what causes all that misery.
When you're right in the middle of that, the first steps are super clear. Number one, get that pain under control. And interestingly, things like NSAIDs are often the first choice. Number two, make absolutely sure it's a kidney stone. And number three, if things get really hairy, we're talking uncontrollable pain or an infection, doctors might need to step in and urgently relieve that blockage.
Okay, so once the immediate crisis is under control, you've hit a major fork in the road. And the big question is, do we wait for this thing to pass on its own, or is it time to take action?
When it comes to passing a stone, size is everything. I mean, look at these numbers. If you've got a stone that's smaller than 5 millimeters, you have a fantastic chance, about 75% of passing it all by yourself. But once that stone gets bigger, your odds start to drop. This size difference is really the #1 factor in deciding what to do next.
So it really boils down to this. On one side of the coin, you have watchful waiting. That's the path you can take if the stone is small and, importantly, your pain is manageable. But on the other side, if that stone is just too big, the pain won't quit, or there are any signs of complications, well then it's time to act.
Now, waiting doesn't mean you just have to sit there and tough it out. There's something called medical expulsive therapy, or MET. These are meds, usually alpha blockers, that basically tell the ureter, that little tube the stone is trying to get through, to just relax. It can make the journey a whole lot easier, especially for those stones that are kind of on the borderline, over 5 millimeters.
So, what happens when waiting isn't really an option and medication isn't going to cut it? Well, that's when we move on to active treatment. And there are 3 main procedures doctors use to get those stones out.
This is a great little cheat sheet for the big three. You've got SWL, which basically shatters the stone with sound waves from the outside. Then there's URS, which uses a tiny scope that goes inside your body to laser the stone directly. And for the really big ones, there's PCNL, which is a kind of keyhole surgery. Each one has its own specialty, depending on the stone.
Okay, first up is shockwave lithotripsy, or SWL. The most important thing to know about this one, it's completely non-invasive. Nothing ever actually enters your body.
I want you to picture one of those old cartoons where an opera singer shatters a wine glass with their voice. It's kind of like that. You lie on a table, a machine uses imaging to lock onto the stone, and then it sends these focused sound waves to break it into tiny, sand-like particles that you can then pass easily. And since it's non-invasive, recovery is usually super fast.
Next on the list is ureteroscopy, or URS. This one is called minimally invasive. A super thin camera does go inside you, but, and this is the key part, it uses your body's natural pathways, so no cuts, no incisions.
So with URS, your urologist becomes this incredibly skilled plumber. They guide a flexible little scope right up to the stone, and once they see it, they use a laser to basically turn it into dust. Then they can either pull out any bigger pieces with a tiny little basket, or just let all that dust pass on its own. It's an incredibly precise procedure.
And finally, we have PCNL. This is the heavy hitter. This is the procedure you bring in for the really large or complicated stones. We're talking bigger than 20 millimeters. It's the most invasive of the 3, but for those giant stones, it's also the most effective.
PCNL is pretty much what it sounds like, keyhole surgery. The surgeon makes a tiny incision in your back to create a direct tunnel right to the kidney. This lets them bring in more powerful tools to break up and literally vacuum out even the biggest stones, all in one shot. Now, because there's an incision, this one has the longest recovery time.
All right, the procedure is done. The stone has been dealt with.
But what happens now? Let's talk about that recovery phase.
One of the biggest questions patients have is about the stent. You hear about them, they can sound uncomfortable, so it's a totally fair question. Why is this thing even necessary?
Well, think of a stent as a temporary helper. It's a little tube that does a few really important jobs. It keeps the ureter propped open to reduce swelling. It creates a nice open road for any leftover dust and fragments to pass through, and it prevents a new blockage from forming. But the good news is, it's not always needed, especially after a simple, uncomplicated procedure.
So, the ultimate goal of any treatment is to be completely stone-free. But sometimes, little fragments get left behind. And while the dust passes easily, any leftover pieces bigger than 4 millimeters need to be watched. Why? Because a leftover fragment can act like a tiny seed that a whole new stone can grow around. And nobody wants to go through all this again.
And that right there brings us to what is, honestly, the most important part of this whole journey. Because getting rid of the stone you have now is great, but the real win is making sure you never have to deal with another one.
And this is exactly why prevention is so critical. Just look at that number. For some people, the risk of forming another stone within just 5 years is over 60%. That is a coin flip you absolutely do not want to lose. So I want to leave you with this final thought. Think of your first kidney stone as a wake-up call. It's your body sending you a very loud, very clear warning. But having a second one, that can sometimes be a choice. It can be the result of not taking the preventative steps you have the power to take. So the question is, what are you going to do to prevent it?